In 3, 2, 1. Stick the wires in, that wire hanging out.
This one?
Just stick it into your pocket too, yeah. However you, that's fine.
Okay. All right. Working as a nurse in a psychiatric facility, I take care of nurses who are suicidal on a daily basis, and it's devastating to take care of people that are your own kind of people who got into this profession thinking they were going to change the world that has now inevitably led them down this path. Nurses more than ever feel like they have to pour from an empty cup, both working during a global pandemic, increased work hours, low staffing, and low morale overall.
I'll be looking at the screen, by the way, just to make
Okay.
sure you're always in focus. So
Okay.
just because I'm not looking at you doesn't mean.
I know for my unit, the morale has gone down significantly this past year. It's really hard. The hospital is a stressful place to work, and when you go home and it's a stressful home environment, there's just no reprieve for the nurses. We come to work and have to take care of patients in a stressful environment and then go home and we can't see our family and friends and we can't travel or experience anything that gives us that emotional break. I know for my unit, a lot of the nurses have looked outside the nursing profession for a new job directly related to the morale and the tension that they're experiencing this past year. I myself have also looked for a new job for that exact reason.
All right, real quick, can you do a testing 1, 2, 3 for me?
Testing 1, 2, 3.
Perfect.
I'd be lying if I didn't admit that I don't think about leaving not just the bedside, but healthcare as a whole. And it's not just because of the work. Of course, it's challenging, but it's also rewarding. Us nurses have a great deal of knowledge and skills, though it's mostly underappreciated. I don't think that anything new has happened. I think COVID has just exacerbated the problems that have always been there. We feel disrespected and sometimes outright physically abused by patients and family members. We feel ignored, manipulated, and taken advantage of by management with things like short staffing and forced overtime. A toxic work environment has become a new normal, but that's not okay. What other work fields are forced to do these things? And on top of it all, there's guilt placed on by ourselves, our peers, by management to just suck it up and keep going. But why? How much of myself do I have to lose for a job?